going to say, let's get this party started. Welcome to the Health and Human Services meeting. Today is Monday, November 15th, and it is 1:01 p.m. Thank you all for joining us today. I would like to call this meeting to order. I do have some changes to the agenda and just wanted to lay out basically the format that we would have our meeting today. I would like to move, you know what, we still have some people coming in. I would like to move all of the business to the beginning of the meeting so that if any of our committee members have to leave, we still have quorum and can vote on our resolutions. And then after we do all of the county business, then we can have a very great conversation about our encampments and some of the homeless issues that we're seeing in our community. So with that said, legislators should have received 2 new resolutions on our agenda that are not on our agenda. And if we could add those to our agenda. The first one is authorization to accept funds in budget adjustment, community health from the health department. And that's ID 10532. Can I have a mover, please? Okay. Leslie, and then Mike Sigler will second. And then comment, Amanda?
Well, at my last GO meeting, we had to add something, I think, and they said we didn't have to vote to add it. That's only at full legislature, but maybe I'm confused. I don't know.
I think, oh, Katrina?
Katrina?
We don't, sorry. You don't need to vote to add it as long as it's a consensus of the committee.
Oh, okay. Is that all right for everyone that we add these 2 resolutions? Okay, I see nods. Sigler, is that all right with you?
Works for me. Thanks.
Okay, great. Those are now on the agenda. And I wanted to ask, Katrina, is there anyone here for public comment?
I haven't received anything and there's no one present.
Great, thank you very much. As far as the chair's report, I am actually going to yield all of my time because I think this is going to be a long meeting. And I really want to make sure that we have time to get everyone's comments in. So I will yield my time and we can use that for discussion. County Administrator's report. We have Amy Hendricks here. Hello, Amy.
Hi. So I am going to give you back some time as well because I don't have much of a report. The only thing I will say is we are in the final, I think today was the deadline for submitting questions for the grant program that you guys have set up with some of our recovery funds. So that is happening. And then those answers will be going out. I think already the first batch have gone out and we are closing in on the deadline to get that moving forward. Otherwise, I think any other reports I have will come up throughout the rest of the meeting. So I'll yield the rest of the time to that.
Great, thank you, Amy. Are there any questions for Amy or County Administration? Okay, I see none. Thanks, Amy. Okay, let's go ahead and vote on and discuss the public health resolutions, the 2 that were sent to legislators via email. The first one we have is authorization to accept funds and budget adjustment, community health in the health department, ID 10532. If I could have a mover, moved by Leslie, a seconder, seconded by Amanda. And hi, Frank, would you be able to talk to this resolution?
Sure. Amy's done much of the work on it, but the Park Foundation has agreed to provide funding to help support the children's vaccination clinics in the way of providing food for the people working at those clinics, as well as other supplies and giveaways for the kids that come through. So we're very thankful that they've offered this to us and would appreciate acceptance.
That's great. My son got his vaccine about a week ago and he got a nice book to come home with. So good job. Thank you, Park Foundation, for your donation. Any questions from committee members? I see none. Let's go ahead and do a roll call. Amanda Champion?
Yes.
Leslie Schill?
Yes.
Henry Granison?
Yes.
Mike Sigler?
Yes.
And I am a yes. That's unanimous. Thank you. And the next resolution that we have is authorizing the salary for position above the salary range for the public health engineer, ID 10531. If I could get a mover. Moved by Amanda. If I could get a seconder, seconded by Leslie. And Frank, would you like to explain this one for us?
Sure. This and the next resolution will have the same theme. It has become challenging for us to recruit licensed professionals into some of our key positions. Public health engineer being one of them. The current salary in our salary scale is way below the market rate. We've known that. We've been looking at it with HR for a while, trying to figure out a solution. And then the proposal came forward to do the salary study. So we kind of put things on pause, waiting for that to evolve. The problem that we have is that our current public health engineer has another offer that would pull him away and would put us in the position of likely not being able to recruit into that position and then having to contract with the organization that he might be going to. And we would be paying a lot more from a contracted rate. So this is something we've been working and talking about. It's become acute because of the individual situation. So we're asking to make that salary more in line with market rates, so that way we can retain our current staff.
Great, thank you, Frank. Are there any questions for Frank? Okay, I see none. Let's vote via roll call. Amanda Champion,
Yes.
Leslie Schill,
Yes.
Henry Grandison,
yes,
and Mike Sigler.
yes,
And I am a yes as well. Thank you, Frank. And we actually have one more resolution for you, authorizing the salary for a position above the salary range for a nurse practitioner in psychiatry, ID 10513. If I can have a mover, please. Amanda moves, Henry seconds. And Frank, would you like to give a little bit of an explanation?
Sure, same theme. This is, I hate to say one is more critical than the other, but this one is more critical in that our nurse practitioners coupled with our psychiatrists are the only ones that are able to prescribe medications. Our current nurse practitioner has another offer. And again, our salaries on the salary scale are not in line with the market. And we are at risk of losing her because she has another offer. So we'd like to increase her salary as well as the salary for a vacant nurse practitioner position that we are currently recruiting. So this has kind of two components to it in this resolution. I do want to say that we have an impending problem on our hands. From a staffing perspective in the healthcare field. I think you guys are all acutely aware of what the hospital is going through and what we're hearing on the news every day about the healthcare sector. We are at a disadvantage in recruitment for staff. And this isn't just nurse practitioners or psychiatrists. It includes our nurses, both at public health and mental health, as well as our psychiatric social workers. The demand is high for their needs, and everyone is paying generally a lot more than we are. And so we're battling against that. We also have an obligation to have 50% of our services be available in person, which means for an individual that might want to just work solely remotely, we don't have that option because we have a licensure requirement to meet. So there's a lot of different things going on here. And going back to the salary study, I don't know how those work. I've never been a part of one, but I will just tell you, we are particularly at mental health in an acute situation. We have several psychiatric social worker positions that are currently vacant. And we're struggling to find folks to fill those. We've met with Lisa Holmes and Ruby to talk through the problem. That they've got some creative solutions, and we're beginning to work to put those in place. But from a healthcare provision perspective, we're going to have to make some hard decisions about how much we're willing to invest in the people doing the work versus our ability to sustain doing the work moving forward. The healthcare world is changing dramatically every day. And as you know, we're government, we don't do things quickly. And so it's really putting us behind the 8 ball and trying to maintain the staff necessary for the services. So that's a bit of my soapbox, just, preparing you guys for future conversations that are coming. But this particular resolution is specific to our nurse practitioners and making their salaries more comparable to the market rate.
Great. Thank you, Frank. And I think many of us who have petitioned and who have talked to our constituents, the one thing that we hear in our community is that mental health is at the top of our list. And so I will speak for myself in saying that if we need more funding towards this, it is definitely one of my top priorities as far as allocating that funding. Henry.
Yes, Frank, with the increases, does this take us to market rate?
Yeah, we think so. I think we're closer based off of what we're hearing from the candidate in the position and what we've seen from some other advertisements. One of the challenges that we have is that salaries tend to be proprietary information in the healthcare world. So the advertisements don't generally list what people are getting. But anecdotally, based on what we've heard and the folks we've been able to talk to, we think this is getting us closer. What will tell us is we're recruiting a vacant position. So we're comfortable with our current employee that, we can have the conversation. How we'll know if we're at market rate is through the recruitment of that vacancy.
And do you mean market rate on the private side or market rate on the public county side?
Well, it's market rate. So
Okay.
people have choices on whether they want to work in public or private. And, speaking completely honestly, we used to rely on our benefit package, as a draw to bring people in. If you're in tier 6 of the New York State pension, it isn't what it used to be. And so it's not the same draw. Our health insurance, is fairly comparable now, right? Because we're all in that platinum plan or whatever it's called. So things have kind of equalized there. So, and we're not working 8 to 5 anymore in government, right? That used to be a big draw factor, but as we're trying to be more constituent or client focused, we're shifting hours and trying to be more available. So the things that used to be the draw that you would sacrifice salary for aren't that draw anymore. So we really have to look at how we compare to the market in general, rather than just, the public sector.
Great.
Thank you.
Thank you. Leslie.
Yes, thank you. Frank, quick question. I appreciate the preparation. I was going to ask about this. Do you anticipate between now and the end of the year that you'll be back for other positions?
So that's a bigger question. These are unique in that there's only 1 or 2 people in these titles. The other ones, community health nurse, community mental health nurse, psychiatric social worker, there's a lot of people in them. So it's a bigger conversation. My hope and talking with Ruby, it's probably going to be the early next year before they get to actually doing the salary study when the RFP and all of that is done. We're in a difficult spot. We have several staff that are leaving in December, retirements, moving on to other positions, coupled with our current vacancies. If we can't fill them with this new recruiting effort that we're putting in place in the next few weeks, we could likely be back to you having a very significant conversation about the amount of service we're able to provide at the mental health department because of staffing. And I would point out, it's not just money. The money's important, and we would always talk about that, but there are structures in place that limit us with civil service and collective bargaining and those things that those right now are the bigger issue for us, because we could make some adjustments with revenues and those kinds of things to try to deal with the financial side of it. But where the structures that we're working within are really what's causing the main challenge.
Just a thought, if it's going to come right before the end of the year or right during the changeover into a new legislature, having a brief about all of those, something really short that gets to it, particularly if we're going to be looking at whole classes of individuals, it would be helpful to have.
Sure.
Okay, I just want to also make sure that we don't get too far off topic. This is a massive issue and we're not going to solve it today. And I'm sure there will be more discussion, and Frank has a lot of work to do on this front. If we could keep the conversation short, Martha?
Yeah, just sort of heads up that we've already, through the public safety workforce issues, we've already kind of raised issues at NISAC about civil service. So I just want to kind of hand off a baton here and suggest that in the coming legislature, working with NISAC to really try to push the state on more flexibility in civil service. There are a lot of many issues. We've gotten a little bit of traction on public safety job positions, but obviously it's bigger, and I hope people will kind of see that as another way to try to make some systemic changes.
Great, thank you. Any other questions or comments for Frank? Okay, Katrina, did we vote on that resolution? Okay, no, we didn't. Let's go ahead and do a roll call. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
and Mike Sigler.
Yes.
And I am a yes. Thank you, Frank. We now have
Thank you
a
all.
resolution for Youth Services Department. We have a budget adjustment, Youth Services Department ID 10510. Hello, Kate Shanks Booth. Nice to have you. Oh, sorry, we got to move that. Moved by Amanda, seconded by Leslie Schill. And we'll do that again. Hi, Kate. Can you
Hi,
talk to
Shauna,
us
how are
about the
you?
resolution?
Yeah, this resolution is to authorize a budget adjustment for allocations received from the New York Office of Family and Children's Services for 2021 to our youth services budget. Every year we receive state funding for youth development and runaway and homeless youth. We estimate allocations for that year based on prior years' receipts of state aid. However, we don't actually get the final numbers until close up to the end of the year. And so once we get those numbers, our budget is adjusted and funds are reallocated to the municipalities, contracted agencies, and to our department for planning and coordination of RHY services. So that is what this is for.
Okay, any questions for Kate? I see none. Let's do a roll call. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler,
Yes.
and I am a yes as well. Thank you, Kate. Okay, one more resolution for today. Office for the Aging. Resolution, grant acceptance and budget adjustment, Coronavirus Aid Relief and Economic Security Act, the CARES, under Title VII of the Older Americans Act. Office for the Aging ID 10512. If I could have a mover, please. Moved by Leslie Schill, seconded by Amanda Champion. And hello, Lisa Monroe. Nice to have you today.
Hi, everyone. Thank you. Yes. So this is CARES Act funding that has come to us earmarked for our long-term care ombudsman program. So the funding we'll use to really do outreach, public information, and recruitment for volunteers who go into assisted living and nursing homes in Chemung, Schuyler, and Tompkins County.
Great. Thank you. Any questions from committee members? I see none. Let's go ahead and vote. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
and Mike Sigler.
Yes.
And I am a yes as well. Great. Thank you, Lisa.
Thank you.
We have some appointments to our advisory boards. For the Office for the Aging Advisory Committee, we have Charlie Hart At-large member, his term expires December 31st, 2024. Oh, sorry, Katrina. Oh, I think you're on mute.
We also have a resolution from DSS.
Oh, yes, we do.
Number 7, okay?
Sorry, Kit, I didn't mean to forget you. You are unforgettable. Okay,
Thank you, Shauna.
didn't want to leave you out. We have a budget adjustment, local early intervention agency, social services ID 10514. If I can have a mover, please. Moved by Leslie Schill, seconded by Amanda Champion. And Kit, can you talk a little bit to this resolution?
Sure. So this is actually a program. This is the public health local early intervention program, and DSS actually funnels state and federal money through to the health department for this program. We received information a little while ago that they have actually seen some significant growth in that. So we're really just seeking spending authority. Increasing by, I think it's 75,431 to make sure that we're able to pay them. It's no, there's no net local cost to this. It's just a pass through of money. So we're just seeking the authority to be able to go ahead.
Thank you. Any questions for Kit? I see none. Let's vote. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
and Mike Sigler.
Yes.
And I am a yes as well. Thank you, Kit.
Thank you.
Okay. Now on to advisory board appointments, ID 10298. We have Office for the Aging Advisory Committee, Charlie Hart, at-large member, term expires December 31st, 2024. William Lesser, at-large member, term expires December 21st, 2024. For the Tompkins County Human Rights Commission, we have Ruth Yarrow, member, term expires December 21st, 2024, and Joanna Green, member, her term expires December 21st, 2024. Can I have a mover, please? Moved by Leslie Schill, seconded by Amanda Champion. Any questions or concerns? If there are concerns, we can go into executive session. Amanda?
Are they supposed to say December 31st? There's 3 of them that say 21st.
Good catch.
Probably it's meant to be 31st, right?
It should be 31st. I'll make sure it's changed.
Okay. Thank you.
Amanda. Good job. It'd be awful if we had 9 days without commissioners.
All
10
right.
days. Yeah. Thanks. Nice catch. Are there any questions or comments? I see none. Let's vote. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
Mike Sigler,
Yes.
and I am a yes as well. That's unanimous and passes. And we have minutes approval for October 18th, 2021. If I can have a mover. Moved by, boy, I have 3 this time. Henry Granison, seconded by Leslie Schill. Any questions or comments? I see none. Henry Granison,
Yes.
Amanda Champion,
Yes.
Leslie Schill,
Yes.
and Mike Sigler. Mike, would you like to vote for the minutes today?
Yes, sorry,
Okay.
I couldn't get to the mute.
No worries. And I am a yes too. The minutes pass. Okay, thank you all for taking care of county business. We are going to actually skip department updates for today so that it allows us to have more conversation with this really big topic. So I would like to have some introductions here. This actually came about as we've been seeing in the news, local news, about the encampments, homelessness at an all-time high in our county. And while legislators and local elected officials could sit around all day and talk about, solutions to ending the issue, we're not really equipped to do that. And so I thought we would actually bring in the real professionals, the people who have been in the trenches and who are working with this extremely vulnerable population, to get an idea of actually what's going on in the jungle, in the encampments. Why are we seeing so much homelessness? Explain the work that they're doing right now, and then for us to really talk about a vision moving forward and how to help the people that live in our community. So I would like to, if we could, I will call on you, and if you can actually say your name and where you're from, I think that would be great so that we have some background. Matt, can you start us off?
Yes. Hi, everybody. My name is Matt Dankinich, and I work for Reach Medical in Ithaca.
Great. Thank you, Matt. Let's see here. Next up is Richard Rivera. Hi, Richard.
Hi, how you doing? My name is Richard Rivera. When you say where you're from, I thought Brooklyn.
Hey.
No, I am from, I work for OER, Opportunities, Alternatives and Resources of Tompkins County, and I work for URO. In both capacities, I work with vulnerable and at-risk people, and they take me into the jungle. I'm also a researcher and ethnographer who's been doing work in the encampments for the last 2.5 years. And yes, and I do outreach there on a regular basis. I'm there almost daily.
That's great. Thank you, Richard. Next is Deb Wilkie. I want to say your last name wrong.
It's Wilkie.
Okay. Great.
Deb Wilkie. I am the Homeless Crisis Alleviation Coordinator for Second Wind Cottages. Carmen Guidi first introduced me to the jungle about 6 years ago, and I've been pretty active down there ever since.
Thank you. Okay, next we have Peter Ventimiglia. Sorry, Peter.
No, it's okay. Everyone does it.
Totally
Peter Ventimiglia from DSS. I'm the homeless outreach worker as well as adult protective services.
Great, thank you. Next we have Natalia.
Hi, everybody. I'm out here right now working with folks, and I'm asking folks if they want to say anything at the meeting. So I'll let you know if we get people that want to speak at the meeting.
That's great. So Natalia is actually out at the encampments right now. We thought that it would be nice to have the people that are living there have some input into our meeting. So thank you very much, Natalia, for I hate to say reporting live because that sounds weird, but for being out there right now and having that perspective, because I feel like all too often we don't have that perspective in these meetings. Ed Bergman. Hi, Ed.
Hi, so I'm the director of APS, but really Pete is the one that'll be sharing today. I don't have much. Pete's our guy that really does the homeless outreach and stuff. So I'm just here to support him.
Great. Thanks, Ed. And
Shauna,
yeah.
we should also say that Natalia is the community outreach worker
With family and children's.
with family
Yes.
and children's.
Yep. Okay, let's get started. I would like
But
to-
Liddy,
Where is Liddy? Liddy! Sorry, you bounced to the top of my screen as I was going down. Liddy
I turned my
Barger.
camera on.
Okay. Hi,
I'm
Liddy.
Liddy Barger. I'm the Director of Housing Initiatives at Human Services Coalition. I don't do direct service in the encampment space, but I do a lot of coordination and behind the scenes work with the continuum of care and generally in Ithaca.
Great, thank you. So let's start off with the current situation. If you could also talk about some of the struggles we've had during COVID. The one thing that I have been absolutely so impressed with is the collaboration of the different agencies. I think that is so very unique to our county in seeing whenever we were in crisis, all of the agencies, it appears, from the outside, have really formed a coalition. And it's just been really amazing to watch. So I want to thank all of you for your work and for your dedication. So many times the people that live, that are homeless are forgotten, and You all are truly our heroes, and the ones that are willing to roll up your sleeves and work with people that are just so vulnerable and ignored in our society. So thank you very much. Let's start with Richard. Can you talk a little bit about the homeless situation here in Ithaca?
Yes. Well, it's a broad issue. We have a definition of homelessness by HUD, which is very specific, and Lydia could speak to it more than I can. But basically, it defines homelessness as a person living in a public space or place unsuitable for human habitation. In Ithaca, we find this place to be the jungle and under bridges and stuff like that. Unfortunately, or yes, unfortunately, that population tends to be predominantly white, almost 100% white at this point. So when we do the point in time count, we count this population, and the only population we count is the homeless population that is white in the jungle. We have a homeless population that is also couch surfing, living in porches, living in borrow rooms, which tend to be Black and brown people. So it's a broad spectrum. In relation to the jungle, it's a population that's been there for a long time in different forms, like the hobos, one time called the hobo jungle in the 80s and 70s. It was a place where people that have power alcohol, and they had houses, but in its current reiteration, it tends to be people who are addicted to substances, substance users, meth, and are truly homeless, can't function in society, and are there. When I got here about 2 years ago, the population was 40 people, maybe. Last year, just before the pandemic hit, there was like 65 people. Then winter comes and the population goes down. The pandemic has changed the situation a lot. The pandemic has forced a lot of people to isolate and stay in the jungle, and some people just couldn't and just left. Efforts by outreach workers to house individuals have housed a lot of individuals. Our house has also offered more spaces. We have had 7 deaths in this year alone from people related to or living in the encampment. We have had floods, bad situations. And what I'm seeing is a trend now of a depopulation of the jungle space. That's not to say that homelessness has been alleviated, but the population didn't grow in any significant way over the summer. And now winter is back. We have had 7 deaths. We have had our house opening up. The work by Deb Wilkie and others to house individuals has been incredible. JD and have housed a lot of people. So the population is rather small now. More visible because of the flooding situation has forced people to seek higher ground, and that tends to be in the more visible edges of the encampment. But the population hasn't grown significantly in the jungle this past year, and now that winter is coming and cold weather policies is being implemented, I see that we're going to see it decrease even more. Some might disagree with me, but that's what I see as just looking at the trends.
Thank you, Richard. Are there any questions for Richard right now? Okay. Deb, can you talk a little bit about Second Wind Cottages?
In terms of Second Wind Cottages specifically?
Yeah.
What we are. So Second Wind Cottages was founded by Carmen Guidi. He had gone on a missions trip overseas to Haiti, was very impacted personally by what he saw in Haiti. And when he came home, couldn't stop thinking about it, but then had heard about the jungle. Had grown up in the area his whole life, but had never gone to the jungle. Went down to the jungle. At that time, it was primarily the area which is known as the Wall. I don't know if you're familiar with where that is or not, behind Agway primarily. Started visiting the shelter. It was rescue mission at that time, asking people, where did you sleep last night? He was so impacted by what he saw in Ithaca in the encampment that he wanted to do something about it. That first year he accomplished that. I think he actually eliminated everyone who was in the jungle at that time, the Wall area. He housed them in campers
on his property and on his business property. Getting through that first winter, he realized very quickly that housing people in campers in upstate New York was not a long-term solution. It was very difficult. That's where Second Wind Cottages, the idea for Second Wind Cottages was born. The initial year, they put 6 cottages up and then 3 cottages every year subsequent to that, to the maximum capacity of the lot of 18 cottages. So some of the work that I do in Carmen is meeting people where they are in their homelessness. And it's really a housing first. However, Second Wind, it is a bit of a program that has the expectation of clean and sober living, which is a challenge for some who aren't ready for that.
Great, thank you very much. And then Matt, can you talk a little bit about REACH and the work that REACH has done?
Definitely. So we are the relative newcomers to the outreach game. We started back in April of 2020, back, as the pandemic was hitting, and there was a clear need for medical services out in the encampments. Folks weren't going to be able to come to our office like they had been, just kind of showing up, having, Deb or Richard drive them to our office and walking them into our doors. So excuse me. So we started going out and in conjunction with the Department of Health, in partnership with them, we were able to start providing COVID-19 testing at the encampment, at the homeless shelter, at TC Action, a variety of places. From that, we actually started doing COVID-19 vaccination. So to date, we've probably done, I would say, over 300 COVID tests and probably close to 400 vaccinations for COVID-19. Primary population being folks who frequent the shelter, folks who are out in the encampments, generally looking at our kind of population, although of course we're reaching folks through the Free Clinic, Southside Community Center. We had a brief moment of kind of like a twin pandemic last year with hepatitis A as well as COVID. We had folks who were coming down with hepatitis A and, needing hospitalization. So we've also been able to start vaccinating folks against Hep A and Hep B in the encampments. And I have to say, probably one of the biggest things that has helped us vaccinate has been our partnership with the health department in the county, and the ability to offer incentives. Something as simple as a $15 gift card has made such a huge difference for so many of the people we work with. We have folks who are now finally up to date on COVID. They've gotten their hepatitis shot. They're getting their tetanus if they need tetanus. They're going to get their flu shot. Because they know that we're able to incentivize these things, although that money is dwindling. We worked with the rest of the team. We had a few positive COVID-19 cases out in the encampments. We're able to handle things from the medical perspective, from the medical side, helping folks with symptom management, helping them with use management if that was needed. Overall, we've just continued doing telemedicine with folks. I think we've done roughly 200 visits through telemedicine, 200 appointments with people. And the thing that always gets me about that number is that over half of them were acute walk-in visits that we didn't expect to be doing that day. I think, really what we've done with that is decrease admissions to CMC, decrease folks going to the emergency room because we're able to get out there and catch their infection while it can still be treated with antibiotics before they need to be IV. So yeah, we're doing all sorts of things out there, really with the combined efforts of everybody helping us get out there and reach folks and get folks to our office.
Wow, that's great. And I actually went out, it was probably a year or two ago with Natalia and Tammy Baker, and I saw firsthand like the collaboration. There was a gentleman who wasn't feeling well, and he actually contacted REACH, and they triaged the situation right there. And they had, FaceTime, and it was it was really good for me to see like the how things occurred in the process. And again, the collaboration is just so important. Natalia, can you tell us what your role as the community outreach worker, what you're doing, and if you have anyone that would like to speak with us, we would love that too.
Hey, yeah, hi, how's it going?
There you are.
I'm here right now with Reach. We're working with people, getting people some supplies, medical supplies, basic like soft granola bars for folks that are having hard time chewing, lack of teeth. We have bottled water we're giving out to folks, warm socks to help prevent what we call jungle rot. It's like when your foot is in the trenches and it gets too wet and it gets sick. We have different hand sanitizers and wipes, and yeah, I'm asking people if they want to speak. They're feeling a little shy right now, so I'll just kind of tap in when they're ready. I come out here to the encampments every Monday from 1 to 4, and I work in tandem with Reach Medical, and it's great. I love my job. I wouldn't trade it for the world. The people are wonderful, and yeah, I'm gonna let you take back over and try to get some people to engage.
That's great. Natalia, if it would also help, if you want to keep your picture off, people are welcome to comment anonymously.
Great, I'll let people know that.
If that would help. Okay,
Okay.
great. Thank you. Okay, Peter, would you like to talk about the collaboration that the county has and what the county's role has been?
Yep. I've been part of the county outreach team for, I want to say almost 6 years now. Collaboratively when it was a rescue mission, now St. John's, going out with them on a regular basis, going to the shelter on a regular basis. With COVID, the shelter going there on a regular basis has slowed down a little, but typically I go out to the jungle with the Salvation Army on Tuesday and Thursdays, providing hot meals to the participants out there. Anyone coming into DSS, we help work with them, verifying that they are homeless, since with the outreach team as well as myself, to verify that they are homeless, to get them into housing, get their public assistance going. Just having this team working together, it's great that we have each other. I mean, we are on constant meetings, text chains, phone calls, just to make sure we all know each other, as well as knowing who's out there or out somewhere. It's not just limited to the jungle. I know some organizations can only do the city. I'm the county. So if there are calls anywhere in the county that someone's homeless, I'll put my boots on and go in the middle of the winter and go wherever I need to find someone. I mean, that's why the county has this position, so I can assist anywhere in the county. Again, it's really the outreach team. It's not just one organization. It's really one big team that we all work together to help who's homeless or going to be homeless, or if somebody wants to get out. We as a team really stick together and help any way we can. Help to help them, not do it for them. It's the biggest thing.
Great. Do you notice that during the period of Code Blue that people are taking advantage of that?
Yep, definitely. I mean, year round, we're always out there trying to see where a participant's at. If they want to come in, if it's summertime, springtime, fall time, we're there for them. Wintertime, definitely, we see a little bit more uptick of more people coming in, if it's the shelter, if it's the hotels, however St. John's can place them. But we do see more people going in. Luckily, we have some people that have been housed, like Richard was saying earlier. So our numbers have been, there's still a lot of homeless out there, but they haven't upticked like they have in the past. So we'll wait to see what the Code Blue looks like. Hopefully it stays, hopefully everyone that wants to come in will come in, but hopefully we don't get a huge uptick, which means that some people left their housing, which we don't want that to happen.
Thank you. And Chris Tettlebaum did contact me from St. John's. He had a prior commitment, so he cannot be here. And I know he's also part of the outreach group. One of the things that he talked about, of course, was it would be very helpful to actually expand the shelter so that there were more beds available. So that was some input that he wanted me to add to this conversation. Henry Grennison, you have a question?
Do we know what the numbers for Code Blue have been recently? How many people have been housed?
That's a Chris question. He
Okay.
he keeps tabs to that, but I know there's at least 16 people that we work with at the Connell. That I was up there the other day handing out meals, and I asked for a number, and I got 16. So they're spread out to the Connell Lodge, Economy Inn, Quality Inn, the shelter itself, and some people out of county because they're not able to live in this county anymore.
And Kit is actually here as well to add more to that.
Sure. So in terms of total homelessness, homeless numbers that are being sheltered currently, we're at close to 90, which is kind of concerning considering how warm the fall has been, and the fact that really the state has not. We just received just moments ago, actually, the Code Blue information from the state. We've been waiting for that. Usually we get that towards the end of the summer or into early fall. And so we're just getting that now. I'm sure that my guess is that with a change in administration at the state level, that things may have been somewhat delayed this year. But so we are somewhat concerned that the numbers are that high and that we are still not into real Code Blue season. On the other hand, it's positive. I would say that we have that many people that are accessing service and looking for sheltering, because sometimes in some years we've seen higher numbers in the jungle and lower numbers of people seeking service. So I don't quite know what to think yet. We also are seeing kind of a trend of, and I attribute some of this to COVID, but I'm never sure. We're also seeing some influx of people from other places. One of the things that we've seen since COVID happened is it seems like people are on the move. I think that with eviction moratoriums coming and going in certain areas, I think we're seeing people relocate when they run out of options in certain places. It doesn't, there's no trend that I can point to, like everybody that comes to Tompkins County is from New Jersey or, something like that. But we are seeing people move around some. So it's kind of a changeable landscape right now in terms of this population and the needs. It's a little bit hard to know how to prepare.
I think one thing that I've found interesting over the years too is that we offer sheltering, whereas other counties, for example, Cortland County offers like warming centers, and so different counties are offering different services. We also have Reach Medical and STAP here in town that offer services for those that are using substance. So those are draws for people that really need care and really need help at housing that many other counties don't have. We have two comments here. We have Kate Shanks Booth and then Leslie Schill.
Yeah, thanks. I just want to also bring to the forefront of the conversation that we're talking about 18 and older as far as homelessness, but we still have youth that are under 18 that are experiencing homelessness, and that COVID-19 has drastically reduced. Most of the time for that age group between 12 and 18, it looks like couch surfing. And so the inability or unwillingness for family or extended friends to have those youth crash on the couch or in their porches we've seen drastic increases in numbers. Right now, without a youth shelter, this is also an issue. One thing that the county has done, and I'm really proud of, hopefully it passed with the budget tomorrow night, is the additional funding for the RHY RFP that we're going to release later this week, that brings that to a funding level that's going to be able to sustain that program, and hopefully we'll be able to open a host home program, which will allow youth to have families to go when they need that respite care. So I just want to make sure we don't forget them in this conversation.
Great. Thanks, Kate. Leslie?
Hi, I just want to, I'm sorry. I just
sorry.
want to,
Yeah, go ahead,
for
Peter.
the, I know I saw Deb wrote something, it's 90 for the temporary housing assistance. On average, we're running between 3 and 4 on cold weather days, but they do come in to get approved for temporary housing assistance. So they don't, we're really working hard on where they're just not maintaining under the cold weather policy, where they come into DSS and get the assistance they need. So on average, we're only running under 5 on for cold weather policy, because then they'll come in the next day and get approved for DSS assistance.
Wow, that's great. Huh. So as far as people being sanctioned, Peter, are we finding that that is currently not an issue?
Without a doubt, there are some people that are sanctioned with cold weather policy. Usually if they're sanctioned, they still can come in and get housed. I'm sorry, I was on the phone trying to get those numbers, so I missed some of that conversation. But yeah, if they're sanctioned, we still can work with individuals to get them into a warm place that evening. Again, if it's the warming center, which is in the shelter as well, or a cot or somewhat. But for most part, we're really working hard on getting everyone to get approved and get them housing in the long run.
Great, thank you. And we have Leslie, Richard, and Martha.
Thank you. Kit, are you anticipating, or is anyone starting to see an impact in the uptick of numbers for homelessness relative to the end of the rental moratorium? So looking at how those collide in the middle of winter.
Sure. So we are anticipating it. The challenge, of course, is it's really difficult to know what's actually going to come our way. What we are seeing right now is some pretty significant increases in some of our other programs. We're seeing increase in our SNAP caseloads. We're seeing people come in and apply for temporary assistance, or kind of a trend that has happened throughout COVID. But again, we're seeing a real uptick in it in a way that we really have never seen other than through this pandemic, are people that are calling and explaining their situations. They want somebody to talk to. They don't want to apply yet because they're saying, you know, listen, when the pandemic hit, I was working 3 jobs. I lost jobs. I moved in with my mom, and my kids, you know, are we're all living together at my mom's. So my expenses are lower, but I'm now not able to get a job, or I'm not able to make the same money I was before, or I don't want to go back to working 3 jobs. And so I don't know what to do. What would I be eligible for on temporary assistance? So we're seeing this kind of like prospective looking. And one of the things we sometimes hear from people is, I anticipate losing my housing at the end of the year. So what would I be eligible for? And I think we're going to see that. I think we're going to see that uptick, even though a lot of it seems prospective right now. But we are definitely seeing an increase in our HEAP, our SNAP, our TA caseloads.
And do we track that and do any kind of projection modeling based on just this anecdotal information, thinking about other folks that might be falling within that demographic?
We certainly track it, but I'm not sure there's really a way to know. I mean, there's really no way to track other than with the state numbers about what our caseloads are. There's not really a way to track by population, because people don't tend to fit kind of neatly into various categories. But we certainly track the trends in terms of what we see in rising caseloads. Our TA numbers are actually still below what they were a couple of years ago because they had dropped slightly. But we do anticipate, if things go the way we think they are, we anticipate that those numbers are probably going to rise up over after the eviction moratorium goes away. So it's a little bit hard to know yet what's happening.
Thank you, Kit. Deb also asked in the chat, does the 90 include Code Blue and folks using THA? I just want to make sure that her question was answered.
Yeah,
So
that's
then
what I was answering.
Okay, great. Thanks, Peter. And Richard, and then Martha.
Yeah, I just want to point out a couple of things. In normal conversation and discursively, the homeless problem in Ithaca is reduced to the jungle, but the jungle doesn't represent the homeless problem. It represents a particular population of homelessness. Despite the fact that we see numbers go down in the population of the jungle, the number of homelessness in Ithaca is going up. because of COVID, because it has such a high poverty rate. I mean, it's incredible, in the high 30s, which impacts certain populations. Among blacks, it's 70%. I mean, so we do have problems, and the loss of jobs and COVID. And so when we speak about the jungle, and we speak about the jungle numbers coming down and how we taking care of those people, we're not taking care of homeless people. We're taking care of a particular demographic, and we're taking care of a predominantly white demographic. So all our outreach efforts that we do collaboratively are really serving a particular demographic, white males in general. So we do have a problem, and we do have a problem in outreach and reaching the people that are also impacted, but are not living among snakes and frogs, because some populations just don't like snake and frogs and don't feel comfortable in that environment, you know? So I just want to make that clear, that the number of homelessness is increasing, the number of the jungle is decreasing, and our outreach efforts are not really reaching those increasing numbers. But more efforts are being put into dwindling numbers, which is really a crazy way of looking at it. Thank you.
So Richard, how can we reach people of color? I guess is the million-dollar question.
When we talk about people hanging out in staff, we're predominantly doing homeless. So I pointed out that the point-in-time count doesn't capture this population, right? So, but when the pandemic started, I started a laundry program, offering free laundry services. Well, I got it through grants to people who are economically insecure or at risk. And in that, I was in tracking that information, I asked the person's status, home status. And I captured a lot of people of color coming in through OAR to get laundry money to do laundry. And they listed their status as homeless, unhomed. So I've been doing it now for 18 months, and I have this data. And I can see when they became homeless, when they got housed, or when they were housed and became homeless, because they come in weekly to report or their status by getting funds. So I have this information that sort of reflects a small sampling of the Black population and their housing status. That's not captured by the HUD's point-in-time counts, but it has this population. So we got people in the West Village living with other individuals, couch surfing. Now, couch surfing sounds like a good thing because the person has a house under the roof. But in some instances, it's worse than living in the encampments, because the power dynamics are such that the individual who owns the apartment tends to exploit the individual, if it's a female, for sex or for services, throw the person out at the middle of the night. I mean, it's just crazy. It puts the person in a more precarious situation. So I reach out to them, and then there's a bigger population than that, right? We got the migrant workers, which is bigger than the Black population of Ithaca. And they're also vulnerable and at risk. So I try to service those too. I service people in the jungle, and I service these populations too. So how to reach them, I do not know. I think we should broaden our scope of what it means to be homeless, to include other populations that are economically insecure.
Great, thank you. Okay, I have Martha, Deb, and then Henry. Okay, Martha, are you around? Okay. Deb?
Piggyback on what Richard said, and you brought up at the beginning, the depopulation of the jungle space. It's true. I mean, they may be more visible, but there certainly are fewer people there. And this is something Richard and I debated about, but that statement alone, the depopulation of the jungle space, is accurate. But like he's saying, in terms of not capturing certain demographics, we're also not capturing all of the homeless population because of those issues that he mentioned, the couch surfing. There's been such an influx right now of people from homelessness into housing, for example, Art House. But when you leave one community and you go to housing in a new community in the Art House, you take your friends with you. So they are much harder to find. And when we do a walkthrough and you're not counting people, it doesn't mean that homelessness isn't existing. They're just in a different space. And for me personally, because I'm in the Art House almost every day, because so many people have gone there, while I'm there, I'm doing outreach there because there are so many of their friends that are there too. It's a very complicated dynamic because when someone's in a tent, it's easy for me or Richard or Matt or Natalia to know where they are and where to find them.
Yeah.
When they leave their state of homelessness outside, unsheltered homeless, it's a lot harder to regularly reach them because they're not people with phones or emails or picking up mail. We have to see them face to face. So I see it, number one, becoming much more difficult. But number two, I'm also anticipating, which was already brought up, when that eviction moratorium ends, or when these individuals who are housed and they brought people with them who are not on the lease, I see a huge explosion into the encampments at some time. I can't predict when that's going to be, but I think the numbers are down now, but I'm anticipating a huge explosion back outside somewhere, whether it's the encampments or elsewhere. That is the most concerning thing to me right now.
Wow, thank you. Henry?
Yes, I'd like to have Liddy address there's an email sent by Chief Parsons about State Street. I'd like to have her address the issues around State Street and what city's doing. Also, Richard talked about the point of count does not include the people. Is that true that you don't include the
Sure.
state street people?
Yes, okay. That's quite a question, Henry. Thank you.
Yes, I know.
So first, it is accurate that, well, a couple things, many things. The point in time count is one of many sources of data we use to calculate the number of people experiencing homelessness in our county. It's a snapshot. It's a sort of known by HUD and COCs to be, it's not considered super accurate. It's something that HUD requires. We all do it, but it's really designed to just be a snapshot. We monitor data regularly using HMIS, which any project that serves people experiencing homelessness in Tompkins County uses HMIS. It's a much better data source. But the HUD definition of homelessness only includes people who are couch surfing if they're in that imminently homeless population, imminently homeless. I put the record keeping requirements in the chat if people want to see like what the HUD record keeping is. The point in time count, we do not enumerate couch surfers. We aren't required to, HUD doesn't ask us to, and we don't. There's been talk every year, really, and that we should do like a local count annually or biannually that can enumerate the couch surfers. They are hard to find, but I think our community is up to that challenge. And that's something that I think the Enhanced Street Outreach team can talk about again for this year. There's no reason we have all the brains and capacity to pull something like that off. Honestly, it's a pretty functional group of people. So that's my answer to that. I recognize that people who are couch surfing are underserved in the homeless response system, and that happens sort of from the very top down. And I think that we can look for places in our local system to make changes for that. As far as State Street stuff, I think all I really there is a task force that has been formed. There was some emails, there was an email chain. I don't think we need to get into the specifics of, and there's a task force. I'm not on the task force. But it is Anissa Mendozaval, I think, is the point person for that. And I think they call it Uses and Spaces Task Force. And they're talking about the State Street corridor and how there's a pot of funding associated with it. And they're discussing how to improve safety for both people who use the space to hang out and walk through it as a conveyance.
So my question is anyone in this meeting on that task force?
I think Kathy is.
Amy
Not to
Hendricks
call out
is.
Kathy.
Amy
I am.
Hendricks is.
So is Amy.
Oh,
Okay.
Yep.
So no one that is actually working with our population.
The population, which
Staff is also on the task force, Shauna.
Okay.
And there are, I believe, 2 additional seats that are going to be filled by people who live in that block of State Street. That could be someone that has, a residence there, or someone who is living on the street in that area or surfing there. So I believe there's 2 additional seats on that task force.
Okay.
It's a very small task force.
Okay.
I think it's important to note that, so it's interesting because I'm clearly come from sort of a systems oriented position, but so this feels sort of systemy, but many of the people who spend time on State Street aren't experiencing homelessness, are housed in housing, what we call permanent housing. It's not all great housing, but most of the people that sort of hang out there don't also sleep there. There are people who sleep there, and some of those folks are couch surfers too. So somebody has an apartment and everybody stays there. But it gets really, language is very important and also very tricky when we're talking about the issues around homelessness, because there are words that do have like certain technical definitions and then people use them different ways. So, and being homeless is one of those words. But the staff issue is somewhat different than homelessness as an issue. They're not identical populations, I guess.
Okay. Thank you. Deborah Dawson.
Yeah, thanks for letting me sit in and speak, because I'm not a member of this committee. I'm a little confused about this conversation only because when this issue arose and what prompted Shauna to have all of you come in and talk about this, it was because there was an expression of concern about the problem of encampments and what the city was doing to enforce the rule against, sleeping rough, as they call it in the UK, if there is a rule. And it was my impression that someone was going to attend this meeting to address that particular piece of the problem. And now I find out there's this very small task force, which doesn't include most of you who probably bring the most experience and would have extremely valuable input into this process. And I don't mean that to in any way reflect badly on Amy or Kathy, but it's still not clear to me, regardless of what the niceties are of whether it's a homeless population or something else that's causing the problem, that the general population doesn't understand or even appreciate, if it did understand, the distinctions you've made, Liddy. All they see is people they regard as scary living on the street or congregating on the street and making them feel threatened, which really doesn't help the community feel like it wants to do something about this problem. So I'm just concerned that we're missing a big piece of the puzzle here in terms of what the city's response is, because no matter how you look at it, they have primary jurisdiction over the problem of people congregating in places that make other people feel threatened. I'm sorry I'm not doing a better job of expressing myself, but I think you get the general idea. I really think we need to know that somebody's doing something, not just to address the needs of the populations that are forced to congregate on the street or sleep rough, but also to address the concerns of the rest of the population that sees this on the street and reacts poorly to it.
Thanks, Deb. You know, and I know that we've had discussions at the county because we are concerned about some situations that have happened in our parking lots, and there's been some harassment as well as some other acts of violence that we have been really concerned about with our county employees. And so, you know, that also is a concern for the legislature. You know, we've internally had those conversations. We have, let's see here, Richard and then Amy Hendricks.
Yeah, I would like to address that because I thought that was the primary focus of this meeting, and it sort of took a turn. And it is the concern of the community in relation to the homeless population, and acts and violent acts and acts of petty larceny, and that is a huge problem. I think our efforts are all geared towards trying to reduce that, to trying to get people housed, to clean up places. Just last week, Chris from the shelter, Deb, me, Cynthia Brock went behind, I think it was the Walmart, the Wegmans, and we cleaned up for our whole area. We took out maybe 80 carts and had them delivered. We spoke to some of the people. We got some of the people involved in the cleaning efforts. As an afterthought, we gave them a gift card, but we didn't promise them a gift card before they participated, but they were eager to participate. There's an effort to build relationships with this population and sort of get them to understand that they're part of a bigger community. Chemung County, for example, tends to criminalize the homeless population there. In Tompkins County, we don't do that. We provide services. We try to get them help. We try to assist them any way we can. And I love that about this community. And I think an effort to try to get the homeless population that live, particularly in the encampments, to be better neighbors could work, but it has to be consistent and it has to be done in a compassionate and empathetic way. As to State Street is a different population. Right? When I first got here 2 years ago, the population that hanged out at STAP was predominantly white. They slept there, they hanged out there, they ate there, they harassed people that walked through there, and there was violence acts there, and it didn't get the attention it did now. About 8-9 months ago, the population shifted to Black population. Now, a Black body tends to be perceived as more violent. That's just a statistical fact. People do that. And we saw a fence go up at STAP to keep people out. We saw more attention being drawn there. And the place was perceived as more violent, and people walked by there. I seen a young Black lady actually cross the street because there was Black people on the other side. And so it's just an implicit bias that takes effect. And I think there are homeless people there. But in terms of the people at State Street, I interact with them every day. I have a young woman right now who's homeless and pregnant, and I'm trying to get a house as desperately as I can. And I'm having problems with that. But there are homeless people there. There are people with problems there. There are people with issues there. And they're not getting the attention that they deserve, or the compassion or empathy that they deserve, because they happen to be Black bodies that are inscribed as more dangerous and violent. So that is a problematic thing that's worthy of a bigger discussion. But to answer the question, we are trying to do outreach work, as I know this for a fact. They do it out of compassion. They do it out of the belief that everybody's worthy of being treated with dignity and respect. And they are trying to change the way these people are perceived. My research has suggested that if we were to get these people jobs and housed and reduce this population, we will reduce petty crime in Tompkins County by like 40%. I'm talking about stealing from Wegmans and stealing cards and sort of vandalism and destruction that happens on a daily basis. But we have to solve the problem. And the way to solve the problem is by continuing to try to get people housed, to get people assistance, to get individuals that don't have the basic level of functionality, the assistance and the supportive services they need to succeed. So housing first is a good concept, but supportive services with housing really works. And that's just my pitch. Sorry for being long-winded.
No, that's awesome, Richard. Thank you. So before we go to Amy, I just want to kind of lay the groundwork for the upcoming questions and comments. We have about 45 minutes left in the meeting. And I know we've talked about kind of what the scene is right now. As many of you know, we have received some recovery funds. And I believe we have around $6 million that will be going out to our community. And very soon we will be putting out applications for people to request some of these funds. Ideally, personally, I would love to see a collaboration with you all as partners to come up with a way that we can help people that are not being served. So I wanted to throw that out there. I see that Amy had a comment, Mike Sigler. And then if we could spend some time on what's your vision for helping the situation. Obviously, there needs to be better communication with the county and the city and the partners that are actually in the trenches to listen to what you have to say. I think that's many times the part that's been missing. So let's hear from Amy.
Sure. So I think that one of the things that we have to acknowledge is there's so many different layers of work here being done and different services being offered by all of the different providers. You have people helping to coordinate it. You have people on the ground. You have people offering medical care and so many other services. So there's a lot already being done. I think as we start to discuss some of the newer initiatives, some of these things we've seen before. One thing, the Uses in Space task force that the city has put forward and has kept relatively small. They are public meetings and they are continuing to broadcast those. So that is part of, I believe, it's a mayor's appointed committee. I think there is some coordination that can continue to be done with that. At the same time, we are also employers and we have, a responsibility to be stewards of State Street and all of our different facilities in the county. And so we're working with our staff and our team to look at, what we're offering as well. What do our facilities look like? How can we help assist in this? So there's a lot of layers to this, and I don't know that, and nor would everyone know all of those layers, but I think one of the pieces is, like you said, Shauna, to continue that conversation, keep the communication open, and keeping all of the pieces together. And we'll continue to do that both from the county administration lens, but also through our different human services agencies, as well as public safety and other communities, acknowledging that we're not talking about one type of person or people or behaviors of one group of people, and that we have to acknowledge that they are people and they're gathering in different spaces for a variety of reasons, much like each of us gather in spaces. And I'm sure at times can have some concern about our own gatherings. So I think we have to continue to modify that and push onward with who we're talking about in each of these spaces and how we move that forward.
Great, thank you, Amy. Mike Sigler.
Yeah, no, I just, I've listened to everything that's been said so far, and we keep kind of categorizing, and I want to hear from people about this. We categorize this, we keep saying homeless, homeless, homeless. To me, it all stems from drug use and mental illness. So while I appreciate what everybody's saying, it's kind of like, even if we had an unlimited amount of housing, we can't force people into housing. And even if we had all the mental health services and all the drug services present, we can't really force people into drug treatment, even though we think, yeah, that would solve the problem. So I guess my question for everybody is kind of how intractable is this problem? To me, it's a drug issue. And unless you have housing where you're saying, listen, you can move into this house and you can continue using drugs. I'm not advocating that position, but I don't know of many people who, until they hit rock bottom, say, yeah, I'm just going to go off drugs. I mean, they're living in a tent in the jungle, for example, or or other places because, yeah, they can take drugs and live free of, society rules, I guess. So I guess that's where my question lies, is we keep qualifying this as a homeless issue. And is it really more of a drug mental health issue? And I include mental health because a lot of people take drugs to self-medicate. So.
Thanks, Mike. That's a good question. Richard.
I think Mike is 100% right. I think to say that it's a homeless issue is to decontextualize, dehistoricize the issue itself. These people are there, and this is across the board, because they have histories of trauma. A lot of them have been sexually abused, physically abused, mentally abused as children. Because of that, they develop mental health issues, or were born with mental health issues. They self-medicate, they become addicted, they become engaged in that lifestyle, and the story rolls on from there. So it is operating on a continuum that starts with histories of traumas. And I know this because I have been collecting narratives. This is an intergenerational problem. The jungle and homelessness in this area, in this environment, didn't just pop up. There are people there who are fourth generation. Since I've been here, a child was born there. That was a fourth generation person from the encampment. I mean, there are people who are disconnected in such a way. These are communities. When I say there was a death in an area, and the individual that died was sort of the patriarch of that area, who enforced the social norms, who kept people together, who protected each other, who organized the community. And that individual dies, that community collapsed because it became an unsafe space, or became a taboo space, or become the marked space. These are communities that are actually living there. And they all are related. A lot of them are related, I mean, and they all have these histories of trauma. So it's not just homelessness. It is trauma, it is substance abuse, it is physical abuse, it is substance use, it is just a host of problems. So I agree with you 100%, Mike. So it's not just homelessness and housing. What I disagree with, though, is that housing them will require them to stop doing to stop using drug, or to hold this incentive that if you have to do this in order to get that. I operate as a harm reductionist. I meet people where they're at. We housed a couple, for example, that was in the jungle for like 7-8 years, Deb and I, and we housed them about 9-10 months ago. And we've been supporting them. And their house, they're still addicted. They're trying to work with their problems. They use staff for support. They use Reach Medical for support. We bring them supplies as they need, food, even garbage tags. And they've been successfully housing now for 9 months. The couple has been able to see their child. They started getting visitation. He is now working, and they're trying to get their lives together. When I said housing and supportive services, they do need that. And I don't know if being a drug addict that way, and that term, I hate that term, but being a drug addict should impede any effort to try to get them the services that they need, to try to restore that sense of dignity and respect.
Thank you, Richard. Deb Dawson, and then Deb Wilkie.
Thanks, Jenna. Well, it's interesting that I know that homelessness is predominantly a symptom of deeper social problems, trauma, substance abuse, mental illness. I'm wondering what's going to happen if and when the impacts of the rent moratoriums being lifted, the eviction moratoriums being lifted, if we now are going to see a subpopulation of people who are homeless in one category or another for purely economic reasons. I mean, how are these two populations going to integrate? It seems to me that's another social problem that we're going to need to address.
And Deb, that was talked about a little bit earlier in the meeting. Deb, would you like to answer that? I think you had mentioned it earlier in the meeting.
Sorry, my dog is barking. Just a second.
Sorry. Or Liddy, you might be able to answer that.
I'm not clear what the question was, but I'm always game to try to answer a question.
She wanted to know what the implications in the future will be once the eviction moratorium is over. Is that right, Deb?
You're gonna have a population of people who are now
First-time homeless, mixing in
first-time
with the population
homeless,
of long-time homeless.
right,
So-
and a different set of problems, basically.
Right. So I think my sort of quick answer to that would be two things. One, it's hard to predict how homelessness, as we define it, as I define it, when I say homelessness, I am talking about HUD homelessness, I'm sorry. It's hard to say how the eviction moratorium is going to affect the population of literal homelessness. What we know about when, pre-pandemic, when you look at eviction models, what the bulk of people who experience an eviction don't go straight from eviction into homelessness. There's usually a period of time where they get basically worse housing further away from services that's less expensive and has less access to services and stuff like that. Or they they hit the couch surfing phase before they hit the literal homelessness phase. So it's unlikely that there's going to be like people moving out of apartments and into the encampment. That's not sort of generally the way that data would tell us that an eviction crisis would play out. But my other answer would be that there are a range of models to serve people with, depending on the circumstances of their experience. So if people are entering homelessness for the first time and have never navigated the system, they may be served with a different set of services than somebody who is experiencing chronic homelessness and has been through the system a few times. So we need to be responsive, and we are capable as a community of being responsive to people's unique circumstances. One of the things that the COC and the county and the city are all engaged in right now is sort of a deep dive into our data, our homeless response system, what services do we need, what do we have, what do we need, all of that stuff. So that is ongoing, and we expect that there will be a report from that research soon, which I think can help us drive our priorities in the way we think about the upcoming issues that we face, I guess. That's all I got. Did I answer the question?
Lydia.
Did I take it? How was my stab? Pretty good?
No, you stabbed pretty well. And
Okay.
your stab was kind of reassuring. So thank you.
Okay.
Thank you. And Deb?
Sorry, I have so many thoughts right now. Obviously, as has been discussed, there's a huge overlap between homelessness, substance use disorder, and mental health. And as an advocate, that's one of the hardest things, is seeing people who I deem to need help, but they can't access that, and I can't help them access that. And the interplay between the substance use disorder and the mental health, it's really confusing. It's really difficult to identify which is which. And the frustrating part as an advocate, seeing people go to the hospital when they're in crisis, and then the first thing is drug testing is done, so the behavior is attributed to drug use, and they're discharged when I've known them long-term, and I know there's significant mental health. They need hospitalization, they need medication management to get that under control. I guess my question for the community, the people that are being seen by the community and are people feel threatened, intimidated, whatever those uncomfortable situations, the reason for this meeting, why are we here? Because certain individuals make certain members of the community uncomfortable, or they don't want to see them. How can we address that? I know a number of people, the people going out to the encampments know a number of people. They're not the people that we're talking about here. They're functioning, working, they're staying in their place and collecting cans and bottles at night, recycling. They're not out making people uncomfortable in the community. So I think
clarifying what is the real problem. Let's identify the real problem and attack the problem rather than attacking a whole population of people would be helpful. And I'm more than willing to help with that.
I think first off, I want to just clarify, this meeting was not to point fingers. It was not to figure out like where the crime is coming from. Like that was not my intent. You know, my idea for this meeting was to get an idea of what's going on in our community. I live in the Northeast area, and you know, whenever I drive around Ithaca, I absolutely see the different populations in their own corners. And you know, I don't see, quite honestly, the two groups together ever. And so, you know, what you're saying, Deb, what you're saying, Richard, I find very true. You know, the conversation that I'm glad we were able to have today was you were able to clarify perhaps some misconceptions that I think all of us had. And I think, you know, we're not going to figure this out in the next 29 minutes, but this is just the start of a really important conversation. You know, as I mentioned before, we have $6 million in this recovery fund, and whether we allocate $1 million or 500,000 or however much the legislature decides to allocate for different projects in our community, this could be something that could really help our community. And we have the opportunity, if the legislature chooses to really have transformative change. So I wanted to bring all of you together to, first off, thank you for this work that you're doing, but also to get a full picture of what's happening in our community and ask the question, how can the county help? What is needed? Richard.
Well, two things. There is a lot of hope here. There's a lot of hope here because, relatively speaking, our population is very small. It's not a gigantic population. New York City has something like 60,000 homeless people. You know, we mentioned 90 at the shelter. Altogether, less than 200. We have a small population. We need affordable housing. You know, we need places that will be supportive. We need places that are sensitive to individuals who are below the level of functionality, the basic level of functionality expected by the agencies that are there to relieve human suffering. What I mean by that is that some of the individuals we work with cannot access the services because they cannot meet those basic requirements of filling out forms, having the patience to sit there, controlling their emotions, having the attention span, all the issues that they come with as human beings. But the problem is solvable. It's not insurmountable like some of the problems that some other cities and counties have. And I think we could do that. And the second point, which sounds a little selfish, is that my research on the encampments and mental health and substance use in Ithaca will probably be published late next year. So I think that will give you a great source of information. And that's not a plug. I'm not plugging anything because it's really an academic piece. But I think it will provide you some great insight into what the encampments is, because it's the only place that place has permanence is in the minds of people that have never been there. It is a flowing space. It's been there for generations, and it's a dynamic space that, understood as a community, will probably help us bring them into the civic life of Ithaca, hopefully. And that's just my final pitch.
Thank you, Richard. Okay, we have Deb and then Rich John.
So my work is an advocate and trying to encourage others to have an idea, just like Richard was talking about looking at his work. I wish everyone could spend one day meeting with a homeless person and walking them through the system. I'm not saying the system's bad. I'm not criticizing any individual agency at all, but it's difficult. I don't know if you can see this, but this binder right here represents about the last 2 months worth of work for one person to access benefits, housing, Social Security. One person. I met, and it's not done. I met with him today and I probably had 30 pages of questions to go through for that one person. One person. This individual happens to be a disabled individual, cannot walk, was in a wheelchair living in encampment, couldn't get to pick up his mail, doesn't have a phone. He didn't deserve to be out there. He wanted housing, and he's still fighting to keep that housing that he's in, thankfully, but it's checking boxes. It's doing what's required. And I have the fear every day that this guy is going to end up back outside. You know, I literally had to take him. Matt's been there. Richard's been there, backing him over the railroad tracks on the wheelchair. I dumped him out of the wheelchair once. He didn't want to be there. And that's a misconception on a lot of these people too. And some of the people out there will tell you that they want to live there. I don't believe it. I don't buy that at all. They're there because they don't think they have options and they can't get through this alone. This is me hand in hand with a person, driving them to an Elmira appointment, driving them here, driving them there, going to DSS, transporting him, one person. So those other 90 people, they all need the same thing. They can't do it alone. And you can't expect a person, in my opinion, sorry, I feel very strongly about this. If you have substance use disorder, if you have mental health, they're going to walk into DSS. They're not going to wait for that phone call. They're not going to sit on the phone after waiting for 2 hours when they want to go out and smoke, or they're out smoking and they miss that call. It's complicated. It's hard.
Thank you. I just want to see if we can talk to Peter or Kit about some of these concerns and see if there's any way from a DSS standpoint that we might be able to help with this barrier.
So Shauna, I think I can say a couple of words about that. So certainly, I think that Pete is going out regularly and working with the rest of the team to try to meet with people, to try to help people with access. We are certainly working with people. I agree with Deb's concerns. It is a difficult process to navigate. There's a lot of forms to fill out. There's a big packet of information that we need, and then we need time. We are not in a situation where somebody can walk in and within a half an hour we can process all of that. We are required by our regulations to verify homelessness. We're required to verify, where did they reside last. There's a whole bunch of documents that we have to collect. We have to try to access birth documents and verification of who people are. We are trying to do everything we can to minimize those hassles and to try to streamline all of that. But one of the challenges is that we, like many organizations, are somewhat limited in terms of, we don't have people. I mean, Pete's position is through Adult Protective Services, and it's ironic actually. We are not really funded specifically for any sort of like homeless outreach position. OTDA tells us that we have to do homeless outreach, but they don't provide us with a specific position for that. Pete is actually in our Adult Protective Services division, which is actually funded by OCFS. And so we have created a hybrid. We've gotten creative and we try to do some of that networking and work to try to create a way to have that outreach and that support. But we don't have, unfortunately, somebody who can do, exactly what Deb's doing. We don't have somebody who can really walk people through the whole process. We certainly work with advocates that are working with somebody, but we're somewhat limited in terms of like how much we can actually do. And we are, again, regulatorily, we can support somebody, but we are not supposed to actually be completing all of the forms on somebody's behalf. So we are we are like other providers, somewhat limited in ways that we, we have a role to play. That doesn't, I'm not in any way trying to say, I'm not trying to excuse anything we're not doing, and I'm not trying to say that that there aren't barriers, because there are. What we can do is kind of fill a role, and then we kind of, compared to a lot of DSSs, we extend that role as much as we can. And I certainly would engage in a conversation about, what can we do? But there are limits to what we do, similar to the necessity of sanctioning people. We can't eliminate all sanctions. We have requirements that we have to live by, even though we do as much as we can. And whenever somebody reaches out to us and says, hey, this person's trying to take steps, they don't fit exactly what the requirements are, we really try to make allowances. So I hope that helps to understand.
Great. Thank you, Kit. I have Rich, John, and then Henry. Oh, I think, hey, Rich.
Thanks, Shauna, for putting this on. And I've been listening. I appreciate all the comments everybody's been making. This is such a multi-level issue. I'm actually at my business in the West End, so I'm in the thick of it. I want to thank all the service providers that are going down and working with the people. Although Deb, comment where you said some serious concerns of West End businesses and neighbors do not relate to those living in the encampments. The meeting we had 2 weeks ago with Cynthia Brock and George McGonigal seemed to be directly related to that. It's the garbage, it's the shopping carts, it's the dogs, it's the screaming, it's the antisocial behavior towards people that are trying to move past the encampments, and the businesses that have bad things happening in them. I don't think you can just wish that away. With that said, these are people, we have to help them. I went to Common Council at their last meeting and suggested the status quo is not all right, that you're not really going to be helping these people in any efficient or useful way if you just allow the encampments to continue. I asked the city, what is their policy about encampments? And they just would not answer. They would not say we allow them. They would not say we don't allow them. They just avoided the question. They did ask the county for a lot of money. They said, oh, the county has to help. But I don't know what they want the county to do if they don't have a policy. And frankly, I think it's entirely unfair to all of you that are working so hard to try to make this problem better that you have to work in a dangerous environment, in a really inefficient environment, and in an environment where there's a really high degree of failure. Shauna, I second your comments that we've got a chance here. We've got this transformational fund. We could really do something, but we need the city as a partner, and I don't see them where they need to be in terms of saying, the status quo isn't okay. We want to do something about it. By the way, at that meeting 2 weeks ago, the neighbors were saying, build more shelters, build them in our neighborhood. That's fine, but get another solution. You're not, the people here are frustrated, but they're not opposed to doing something transformational, even if it has some impacts locally. It would be so much better than what what we're just letting happen now. Thanks.
Thank you, Rich. Henry and then Richard.
Why don't you let Richard go first?
Okay. Uh-oh.
I love John's sensitivity to the issue. I mean, it is really a complex issue, and there are human beings, but I think this is a transformational moment. I like that idea because I really believe that. I think the trends are trending towards that way. As a solution, I think one of the things we could do, I mean, he does amazing work. He got volumes of people that she has worked with, and all the paperwork they filled out. And she walks them through there, and she sits with them at DSS for 2 hours. And I know DSS is an institution and it operates in that way. And I don't know what we could do to fix it. But I think one of the things we could do, one of the things the county could do, is to hire a social worker whose job's description is specifically to walk these people through, to help these people on a ground level. I do outreach work. I'm not a social worker. I'm there to sustain life. That's all I'm there to do. I'm there to help people when they got foot rot. I'm there to help people when they got Hep C problems. I take them to reach. I drive them. We had one case of COVID when the whole pandemic, at the height of the pandemic, and we were able to isolate that individual in place, supply him with what he needs, water, food, hot water, whatever he needed. That work was going out there in the snow to do that, and with a sled behind her. And she was able to do that. We did it to sustain life. We had a social worker to do that work that's actually paid to do that. I think we make some inroads in trying to get these people housed. A person who's sensitive to their problem, who understands trauma, who understands history, who build the relationships they need. Because that's the key point here. The key point is about relationship building. I understand a task force that's working on State Street. But if they don't build the relationships with the people that are hanging out on State Street, they're never going to gain the trust of those people, and they're not going to have any success. I can tell you that because it took me months to get some people to even speak to me. You just can't show up and say, I'm here to do this, and it's going to work. So I believe there's a transformational moment, and while John was talking, the idea occurred to me that if this county had a social worker, whose job was specifically to do this sort of on the ground outreach and walking people through and focus on individuals and work in conjunction with DSS, I think we will have a significant amount of success in getting some of these individuals housed into treatment. Because I can't tell you how many times a week somebody comes up to me and tells me, I want drug treatment. And the only access to that is if the person is currently using it. And they have to go to Cayuga Medical, and they have to get evaluated, and it's difficult to get through a program. I think having a social worker navigate this with the person would be great because they have the knowledge, they have the training, and they have the connections that will make this possible. So I think this is a transformational moment, and I think if the county hires a social worker for this purpose, I think it'll be.
Thank you, Richard. So I guess my question for Kit and my colleagues might absolutely kill me for bringing this up, since we're voting on the budget tomorrow. If the legislature were to allocate funding for a new position in DSS, could they fund a social worker that would specifically be able to help people fill out the paperwork?
So Shauna, while I'm incredibly grateful that you're thinking about that, I'm not opposed to that entirely, but I would need to think about it. I don't know if DSS is the right place for that. One of the challenges with putting that position at DSS is that then there are certain regulations that we have to live within, which are the limitations already. Right. So it may be better if there is, and I feel like I'm kind of shooting myself in the foot when I say this, but it is honest that it may be less confining, less limiting, and more helpful to the community if there was a position like that was a part of, I don't know, a private agency.
I'm not right. Yeah. I mean, there's, quite honestly, there's such a stigma towards DSS, and I'm not sure that, unfortunately, DSS has the relationship with people, and they feel a comfort with someone who might be going out and doing this work. So I do see what you're saying, Kit.
Yeah, we should also, I would like to talk to Natalia if she's there, because I know with the community outreach worker, they do, or they pick up many of these things. They in fact are case managers or quasi case managers for people. And I'd like to hear from her about this topic and also about solutions that she sees. Natalia?
You want to know about the conditions that I see? I'm sorry.
About the case management functions that you guys serve and other case managers that serve the populations, and also what do you see as some of the solutions? What do you think about beyond funding more community outreach workers?
Yeah, beyond funding more of us, which would also be a good idea. I think we need people to do very simple things that we don't consider. Like, for example, there's a really high illiteracy rate in our county. Literacy is super important if you're supposed to fill out a 30-page packet for DSS. We need to help people learn language and writing. We need to build agency within people so they feel motivated and connected and like they can do what they need to do. I would love to see, I know I've said this at basically every meeting I've ever been to, and I've been asked to express a solution. We need a safe consumption site. People are consuming drugs out in the woods in the middle of nowhere. And then if they die, they're out there, they can't access Narcan. They might be leaving their equipment everywhere, and we would like to make sure it's safely disposed of. So we really need something like that. We've had so many overdose deaths in just the last 6 months. We really need something like that. And I think we just need to also, in general, lower the threshold of care for folks. For example, I connected somebody from court last week to TCMH, but they won't get a call for 8 weeks to do an intake. And then after that, it's just a huge, long waiting process when we could have low threshold care where somebody could get services easily, maybe more walk-in kind of style care. So it's just more accessible and less waiting, because people get really disappointed and just tired of the waiting game. So just more services that are immediately available, easily available. Yeah.
Thank you.
Thank you.
Yep. Thank you. I have Deb, Leslie, and then Richard. And I would like to just remind people that we have about 8 minutes until 3 o'clock. So just a time check-in. Deb?
To talk fast. And I don't know if this is county or city or how it falls, but I know there's been discussion about a sanctioned encampment too. And I know the people I work with probably would be resistant to that, but I see that as being a real solution in the interim while we're waiting for permanent long-term housing for folks. There just isn't enough housing right now. A sanctioned encampment, I've advocated for years, and we tried, Richard and I, collaboration between OAR and Second Wind to have a common space downtown. But I also think a common location where service providers could meet in one location would make accessibility of services so much easier. Again, when you go with someone first, you start at DSS, and then you have to go to the shelter. And then if you need medical care, you go somewhere else. It's a lot of jumping from place to place to place, where if a provider from each agency could meet in one place and you kind of hit everything and at the same time do their laundry. I think one location would really, really be helpful. So I think I agree with Natalia, but I slightly disagree because I think there are so many services already. It's just the ease of accessing all those services. And the sanctioned encampment, I think potentially has a lot of potential for helping the issues with the neighbors, the whole community at large, because there have even obviously been neighbor issues within the encampment. And I recognize doing what I do that EMTs won't go in alone. Police don't like to go in alone. I mean, there's this perception that's really dangerous. I walk through there alone. Everyone knows me. I don't perceive it as being dangerous, but I can see why those parties may feel that way. Just changing the whole environment. And I think if it was sanctioned in a certain location and those outliers who don't like that move elsewhere, I'm okay with them moving back to the sanctioned location, being forced to move. Not necessarily specifically policed, but oversight just like there would be in any other neighborhood. Because the way I perceive, and I guess I need to be forthright about this, is I don't live in Tompkins County. I live out of county and I travel there. But my perception is sort of an outsider who spends an awful lot of time there is the city and county are kind of hands off in that space. So my role would probably be different if you gave more guidelines around that space. I'm going to continue going in to help people because people there need help. For instance, certain times when certain spaces, the city has made a statement, no more camping allowed in this area. You know, if police were there, of course, I'm going to respect them and not go into that space. But if they're not there and people are camping there, I'm going to go there. I don't know if that makes sense, but.
Thank you. Thanks, Deb. Leslie and then Rich John.
Thanks. So a number of people on the call have raised the concern. It's a primary concern of mine as well, which is just a straight lack of affordable housing. And having the housing as a housing first strategy gives people an opportunity, maybe to rest, maybe to think, maybe to rebuild. I'm wondering from the service provider's perspective, for those that are still on the line, we have a number of supportive housing developments in the county. A lot of them are along the Route 13 corridor, State Street area. So we have SRO, we have housing for women and their children that are coming out of homelessness. Many of those have come through some of the county's Community Development Housing Fund program, as well as, of course, are bringing a lot of state and federal funds that have helped develop those in partnership with TC Action and others. From your perspective, we're thinking transformational. I'm thinking housing. I'm thinking about some built structures. What do you think are the most effective projects that have been built in the last 10, 15 years that are actually supporting folks in their transition to second wind cottages, to many of these other projects as well, that are helping different people in different ways? But are there definite models we should replicate or look to, be thinking about? What do you think have been most effective to really help people make the transition?
Let's see.
I'd answer that.
Yeah, go
Sorry.
for it, Deb.
I don't think it's a one size fits all solution because there are people at each level. I mean, second wind, even though it's housing first, it's really not housing first. If you are still in active addiction of what, whether it's drugs or alcohol, it's not necessarily the right place because you have people in recovery there. It's almost like layers. You need all of the layers. It's not a one size fits all solution.
Thank you. Natalia has her hand up, and then Rich John and Kathy Schlatter.
Hi, I just wanted to suggest, if we're going to talk about housing and how that could be a solution, to have a couple more shelters in the area that aren't SJCS. SJCS is the only shelter in our community. So once you get kicked out of there, or maybe you're sanctioned from there for whatever reason, then the only option is the street or to couch surf with somebody else. So I'm not saying that the person wouldn't get kicked out of the next place, but I'm saying that it's good to have different opportunities for folks. And kind of like what Deb was just saying, some people need to remain in recovery while others might still be actively using. It could really be helpful to have a space where people can sleep at night and then not worry about, getting kicked out for using drugs. Yeah.
That's great, Natalia. And I think we've seen in other communities how they have had more harm reduction housing and high threshold housing, and it's been really effective. Let's see here. Rich John and then Kathy Schlatter.
Yeah, Shauna, I just wanted to respond to your question. It may be getting a social worker in would help.
I'm sorry, Rich, you're
reluctant.
Your sound is not very good. If you want to take off your picture and maybe your sound will work better.
Is that better?
Yes.
Yeah, I don't think I'd vote for that, even though it might be a good idea, because I think, one, we need to do something as part of a comprehensive plan. And I really believe we need the city to have a policy that we can't act alone or independently. That's what they would like us to do. And just they could continue to ignore the issue. They need to decide what direction they want to go. And then I'm there all day. I think we should really work with them and support them.
Right. I think the one part that I was concerned about, and that's the county part, and what I'm hearing from Deb and Richard is that the county forms are a massive barrier. And that in fact is a county function. So that's why I was throwing the idea out there. I'm not going to make an amendment. This needs much more conversation. It's half baked. So
no, it is half baked, but I think it should be in the oven. You've got a good idea there that we try to streamline this process. It shouldn't be so hard, but we're just not ready yet.
Yeah. That's right. That's right.
Thanks.
Kathy?
Hi, yeah, thanks. I'm just going to talk quickly and try to address a few points. One, I just want to remind everybody that we have a study that's going on currently, that's been funded by the county and the city, where someone is looking into a lot of these issues. Hopefully we will have a report out on that by early next year. I'm also going to join in. I don't know that we're going to learn a lot that we don't already know or haven't already heard. But after doing this work for a long time, if you ask me what kind of housing we need, I would tell you that we need more SROs and more no barrier supportive housing. Those are not the SRO so much, but the no barrier supportive housing is expensive housing to do. It also needs an agency that is willing to do this, that can run these. And that agency would need a lot of support in order to do this. And to Rich's point, I have been on numerous task force at the city throughout my career talking about the jungle and what we should do about it, and homelessness and the encampments. And all the task force seem to get to a certain point in the city, and it's that point, whether you're going to sanction or not, whether, where's the liability, there's a lot of things involved in that. And they cannot go very far after that. I actually think they are closer right now than they've ever been to taking that step. I think some of that has to do with the funding that is available now that was not available before. But I think if it's any hope, I think we may be closer than we've ever been before to. And I agree that it is a community-wide problem, but the city has to take that stand one way or the other before a lot of this can move forward. So that's my 2 cents. I have to run off to another meeting.
Thank you.
It was really good. Thank you for having this discussion.
Great. Thank you, Kathy. Deb, would you like to close us out? Uh-oh, you're on mute.
Thank you. I don't know if this is the best way to close this out, but I think something that hasn't been mentioned today that's an important factor that contributes to people living outside are individuals who are registered sex offenders. Their ability to access any housing at all is so restrictive. And I'm not talking about repeat offenders, violent offenders. These are offenses that took place 10, 20 years ago, and the men are still living outdoors. It's a real problem. It's a real problem. I don't know what more I can say, or they need to say anything more about it, but it impacts their ability to work. It impacts their ability to obtain housing. And that's a factor too that just hasn't been brought up today.
Wow. Thank you, Deb. Thank you. This has given us so much information. And again, I can't thank all of you enough for doing this work. This is one of many conversations that I suspect we will have in the future. So thank you very much for coming and sharing your experiences with us. If there's no other business, I would like to adjourn the meeting. Thank you all. Appreciate it.